Yes, ma'am.
Okay. So what are the topics of degeneration we discussed up till now? What is degeneration? Yes, what is degeneration?
Structural and functional changes in tissue or cell.
Functional changes
Yes.
occur at tissue elements.
Tissue elements. Okay. What is fatty degeneration? Yes. What is fatty degeneration? What is hyaline degeneration?
Abnormal deposition of fats within parenchymal cells
Yes.
is fatty degeneration, ma'am.
Okay. So what are the changes occurs at the level of liver? Fatty degeneration, it is commonly described or discussed with the liver changes, okay, than any other organ. So what are the changes occurs at the level of liver in case of fatty degeneration? Yes. What are the changes occurs in the liver? What are the causes of degeneration of fat? Yes. The students from
Causes, ma'am, it's chronic malnutrition,
yes,
dissolved fat,
yes,
accumulated fat
Grace syndrome, chronic alcoholism.
yes,
due to
yes,
lack of oxygen. There is
yes,
fatty deposition.
yes.
And then hepatitis.
Excess of
Diseases of
lipotropic factor.
liver.
Hyperlipidemia.
Yes, yes, hyperlipidemia. Okay. Then
Obstructive sleep.
obstructive
Sleep.
sleep.
Nana.
No, 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 no. So diseases of liver. Then which type of diseases? Yes, viral
Chronic disease
infections.
like TB.
Viral
Hepatitis.
infections, not TB. Viral infections of liver. Okay, due to viruses, hepatitis A, hepatitis B, or due to cirrhosis. Okay, some structural and functional damage occurs with the liver due to collection of abnormal fat, that is neutral fat inside the hepatocytes. That we call it as fatty degeneration. And when the liver is not diseased, but still the fat get accumulated inside the liver, then that sort of condition we call it as infiltration. Okay, so infiltration occurs in the normal hepatocytes, normal liver tissues. But degeneration, fatty degeneration occurs associated with some disease factor. Okay, either the disease of the liver or either intoxication or any chemicals, anoxic condition, toxic condition due to bacteria like Clostridia or diphtheria. Okay, so such type of conditions gives rise to fatty infiltration, fatty degeneration. Now today we are going to discuss about amyloidosis, that is amyloid degeneration. Okay, so this term is used for a group of diseases characterized by extracellular deposition of fibrillar proteinaceous substance. So this definition is very important. Okay, so the group of diseases, they are characterized by deposition which of proteinaceous substance, which is mainly extracellular. Now this particular get demonstrable on the cut surface of the organ containing amyloid, which stained brown in with the iodine and violet. with the addition of dilute sulfuric acid. So these are the stains we use for amyloid for demonstration or to diagnose. That is iodine and dilute sulfuric acid. So amyloid degeneration is a very important part of this degenerative changes, which may shows at the primarily it is reversible, but secondarily or whenever it becomes chronic, it will give rise to permanent destruction of, or it changes the metabolism of the organs where this amyloid get deposited. Okay. Now there are types of proteins that take part in this amyloid degeneration. Okay. Now there are three types of proteins. The first SSA, that is serum amyloid associated protein. It is a precursor form of protein. SSAA, SAA, that is serum amyloid associated protein. It is a precursor protein and it is highly density lipoprotein. Okay, it is nothing but high density lipoproteins, and the levels of which this lipoprotein levels or this SAA protein levels which increases along with long standing tissue destruction. So whenever there is tissue destruction occurs which is chronic, so in that case this SAA protein forms, which is nothing but a high density lipoprotein. Okay. Now what is the short form of high density lipoproteins? Yes, students from winter batch.
HDL, ma'am.
Yes, HDL. So it is high density lipoprotein, which is very helpful for this carrying the atherosclerotic plaques or cholesterol up to the liver for excretion. Okay. So this lipoprotein always binds the cholesterol and bring it to the liver for excretion. So it is very it is not dangerous, but it is helpful for heart or the life of the blood vessels. Okay, high density lipoprotein. So the levels of this increases whenever there is chronic tissue destruction occurs in the conditions like rheumatoid arthritis or renal failure or tuberculosis. So in that conditions or any the conditions like this cancerous conditions, malignant conditions, in that this levels of high density lipoprotein get rises. And second form is AL, that is amyloid light chain protein. AL, the long form of AL is amyloid light chain proteins. So here the fibrillar protein, it consists of polypeptides. This fibril, it consists of polypeptides, that is 7,500 to 23,000. These polypeptide chains are present in this fibril, which may be made up of whole immunoglobulin light chains, either lambda or either kappa chains. So this AL protein, that is amyloid light chain protein, the fibrillar protein consists of the polypeptides. That is, how much it is? It is 7,500 to 23,000, and it is made from the whole immunoglobulin light chains, either lambda chains or kappa chains. Then second, this third variety is AA, amyloid associated protein. AA, amyloid associated protein. This is amyloid light chain protein and this is amyloid associated protein. So here the fibril protein consists of polypeptide, that is 9,500. 9,500 polypeptides are present in this AA type of amyloid, that is amyloid associated protein. It is having this polypeptides, they are having 76 amino acids and which derived from the precursor protein, that is SAA. This AA protein get derived from the precursor protein, that is serum amyloid associated protein. So these are the types of proteins in which this SAA, it is known as precursor protein, and this AL and AA proteins, they are associated with the specific disease conditions, or these diseases they act for a stimulus for this formation of AL amyloid or formation of AA amyloid. Okay. Now this AA amyloid is always originated from this precursor protein SAA, that is serum amyloid associated protein. Serum amyloid associated protein, amyloid light chain protein, and amyloid associated proteins. Now this is the structure of amyloid protein. This is structure of amyloid. It is always presented as cross B-plated form. Always these fibrils, they get crossed, and this fibril, that is this white thread you are looking, in that it contain protophils. It contain protophils. The microfilaments present in this each fibril, they are known as protophils, and this fibrillar protein is always remain cross B-plated. It is always presented as a crossed protein, cross fibrils. Okay, so the fibers are long, they are stretched and moderately curved fibers. They are generally unbranched, and the fibrils can appear as a wavy filaments, rod shaped, with diameter ranging from 5 to 25 nanometer. Okay, now this amyloid, now more than this structure of amyloid. In the structure of amyloid, the amyloid, it is formed by 90% of fibrillar protein. Any amyloid formed, it is made up of 90% of fibrillar protein, that is cross B-plated fibrils, and 10% of this amyloid, it is formed by P component. 10% of the amyloid, it is formed by P component, that is pentagonal shaped glycoproteins. This P component is nothing but pentagonal shaped glycoproteins. So each this amyloid, it is made from 90% of amyloid, that is fibrillar proteins, and 10% it is made up of P component, that is 10%, that is pentagonal shaped glycoproteins. Okay, so this is the structure of amyloid. 90% it is fibrillar protein, and 10% it is made from the P component. Okay, now this diameter of each fibril, the diameter of each fibril, it is given here 5 to 25 nanometer, and the diameter of protophil, that is this fibrils, they contain microfilaments, they are known as protophils, and the diameter of each protophil is 2.5 to 3.5 nanometer. 2.5 to 3.5 nanometer is the diameter of each protophil. So this is all about the structure of amyloid. Now, what are the characteristics of amyloid? How we this characterize this particular amyloid proteins? So there are certain characteristics of amyloid protein which it appears as a extracellular. Always this amyloid, it appears extracellularly or get deposited extracellularly. Second characteristic is it is homogeneous, it is structureless and eosinophilic hyaline material. So these are the four characteristics of this amyloid protein, that it is extracellularly deposited, it is homogeneous, it is structureless, and it is eosinophilic hyaline material. Okay, so these are the characteristics of amyloid, and this is the structure of amyloid. Certain things they are not given in this particular picture, but I explained you that amyloid, it is made 90% by the fibrillar protein. These fibrillar proteins, they are cross B-plated proteins, and they acquire 90% part of this amyloid, and 10% of this amyloid, it is formed with the P component, that is pentagonal shaped glycoproteins. Okay, understood?
Ma'am,
Yes.
ma'am, the last character of this protein was extracellular deposition,
It is
homogeneous.
here, see here, it is written over in this slide. Amyloid appears as extracellular, it is homogeneous, it is structureless, and it is eosinophilic hyaline material because it takes eosinophilic stains. Okay, eosinophilic hyaline material. And these are the characteristics of amyloid. Okay. Now, the next part, see, this is the structure of amyloid. Okay. So this is all about of structure of amyloid. Just I explained you. The next part we are going to discuss today is pathogenesis of amyloidosis. Okay, pathogenesis of amyloidosis. Now here this pathogenesis, there are certain steps of pathogenesis where in this slide it is not given, but I am going to tell you, you can write down the pathogenesis of amyloidosis, and it is explained with the help of few steps. So first step of pathogenesis is stimulus for, this is the stimulus for amyloid precursor protein. Stimulus for amyloid precursor protein. The second step of pathogenesis is increased soluble precursor protein. Increased soluble precursor protein. Then next step is nucleation for fibrillogenesis. Nucleation for fibrillogenesis. Then next is partial degeneration, that is proteolysis. Partial degeneration, or we call it as proteolysis. And lastly, there is formation of insoluble precursor protein. That is either AL protein or either AA protein forms this pathogenesis. Okay. Now, please look in this particular chart. Here, I am going to explain you the pathogenesis with the help of steps according to AL amyloid and according to AA amyloid. Okay. So this stimulus for AL amyloid, it is multiple myeloma or B cell lymphoma. Here it is unknown, it is given unknown, whether it is carcinogen or not, there is a query, but you can write down the stimulus for AL amyloid is multiple myeloma or B cell lymphoma. multiple myeloma or B cell lymphoma. Here you can write it down, multiple myeloma and B cell lymphoma. Then there is monoclonal B cell proliferation. Here, whenever this stimulus occurs, stimulus for amyloid precursor protein, which one is amyloid precursor protein? It is, yes, SAA. It is a precursor protein, no?
Yes, ma'am.
So there is stimulus for this precursor protein, and the stimulus is in the form of disease, that is either multiple myeloma or B cell lymphoma. Okay. After that, there is monoclonal B cell proliferation. Okay. So this proliferation stimulates plasma cell and B lymphocytes, plasma cells and B lymphocytes. So there is formation of this immunoglobulin light chains, either lambda or kappa chains, either lambda or kappa chains. Here this increased soluble precursor protein in this particular steps, there is the soluble precursor protein, it will get rises. Okay. Now the partial degeneration, it occurs in the macrophages. Here the partial degeneration, that is proteolysis, it occurs in the macrophages. And whenever this degeneration occurs in the macrophages of this particular serum amyloid associated protein or the precursor protein, it is get converted into insoluble precursor protein, insoluble fibrillar protein, insoluble fibrillar proteins. We call them as AL protein or AL amyloid. Okay, this is how this AL amyloid get forms. Pathogenesis of AL amyloid. So according to the pathogenesis, there must be some stimulus for formation of this amyloid, that is for precursor protein. Stimulus is for amyloid precursor protein. Then there is increased soluble precursor proteins. So first step is there is monoclonal B lymphocyte proliferation. They stimulates plasma cell to secrete immunoglobulins. That is in excess amount IgG it forms. IgG it forms with intact lambda or kappa chains, and the partial degeneration according to pathogenesis, that is proteolysis, it occurs in the macrophages. Here it is not given, but you can write it down that partial degeneration according to the pathogenesis, it occurs in the macrophages, and there is formation of insoluble insoluble fibrillar proteins, that is AL protein forms. Okay, of course it is the abnormal accumulation, extracellular accumulation of proteinaceous fibrillar substance. Okay. Now the second one is AA amyloid. How this AA amyloid get forms? Now the stimulus for AA amyloid is chronic inflammation or cancer. Chronic inflammation or cancer, it gives the stimulus for formation of AA amyloid. Now at the first stage, here there is activation, because of the stimulus there is activation of macrophages. So this macrophages, they causes release of certain cytokines or chemical mediators such as interleukin 1 to interleukin 6. These are the cytokines get stimulated by the macrophages, and there is formation of this serum amyloid associated protein in the liver cells. Okay, thus here the soluble precursor proteins increases. Soluble precursor protein increases in the liver cell, and here the partial degeneration occurs in the reticuloendothelial system. Yes? Is any query? Yes, students, you can interrupt and ask. So here there is serum amyloid associated protein get forms in the liver cells, and this partial degeneration or proteolysis, it occurs in the reticuloendothelial system. And whenever this partial degeneration occurs in reticuloendothelial system, this AA proteins get formed, or AA amyloid get forms extracellularly. So this is the pathogenesis of formation of AL protein and AA protein. Okay, according to the steps of pathogenesis, I am again going to repeat the steps of pathogenesis. If it is missed, you can write it down. The first step is stimulation for amyloid precursor proteins. The second step is increased soluble precursor protein. Then next step is nucleation for fibrillogenesis. There is nucleation for fibrillogenesis. All these things, that is nucleation and all, it all takes place in that particular cells. Okay, and the partial degeneration, the next step is partial degeneration. It is again, it happens according to the type of the protein or type of the stimulus. So partial degeneration of AL amyloid, it forms in the macrophages, and here partial degeneration or proteolysis, it is formed in the reticuloendothelial cells or system. Okay, and last step is insoluble precursor proteins get formed, that is either AL amyloid or AA amyloid. So you always do this pathogenesis according to the steps of pathogenesis given to you. Okay, so from that you can make out this particular, and always try to remember with this differentiation, that is what is the stimulus for AL amyloid, what is the stimulus for AL amyloid, then what is the stimulus, what happens after stimulus of this disease in case of AL amyloid, and what happens after stimulus of for AA amyloid. Like this you can remember this, all the pathological steps or pathogenesis of the formation of this insoluble precursor proteins. Understood? Is there is
Yes,
any
ma'am.
query?
No,
Okay.
ma'am.
Okay. It is little bit complicated, but if it is asked in exam, you have to write down this pathogenesis of amyloidosis according to this particular chart. Okay.
Good afternoon, Miss.
Yes, good afternoon. Who is there? The next one is, next part we are going to study is classification of amyloidosis. See here in this particular chart, it is again given for the stimulus and all the things which we just discussed all about this pathogenesis of formation of AL amyloid and AA amyloid. Okay. If you want, you can take the screenshot of this slide also. Same thing. Okay. Now the classification of amyloidosis. Now the amyloid may be classified based on its constituent chemical fibrils into categories such as AL, AA and ATTR. It is not related to your syllabus. So we are just going to deal with this AL and AA amyloid. Okay. It is divided into systemic amyloidosis and localized amyloidosis. Systemic and localized. So the systemic is a generalized pattern which is subclassified into primary amyloidosis, then generalized primary amyloidosis, generalized secondary amyloidosis, then hemodialysis associated amyloidosis, which is not given in this slide, hemodialysis associated amyloidosis, and fourth one is hereditofamilial amyloidosis. Okay, so this is all about of systemic amyloidosis. It is generalized pattern and it is subclassified into four groups: generalized primary amyloidosis, generalized secondary amyloidosis, and hemodialysis associated amyloidosis, and fourth one is hereditofamilial amyloidosis. Okay, so these are the four types of systemic, that is subclassification of systemic amyloidosis. Then second one is localized amyloidosis. Here in localized amyloidosis, we are going to discuss about senile cardiac amyloidosis, senile cerebral amyloidosis, and endocrines associated amyloidosis. Okay. So we are going to discuss about senile cardiac amyloidosis, senile cerebral amyloidosis, and endocrines associated amyloidosis. Okay, so this is the classification of amyloidosis. It is basically classified into systemic and localized. So you write it down, that is systemic and localized amyloidosis. Systemic into four groups and localized into three groups. Okay. So we are going to discuss about this amyloidosis. I'm going to again call the meeting in few minutes. You can join, I think, in that particular this meeting. Okay. Try to join again.
And same link, no?
Same link. Try to this tap on the same link. We will try. Okay. We will see what happens.
Okay, ma'am.